All right, here we go. We're going to kick things off with unit plan. I'm going to go through these pretty quickly. If you have questions, just let me know. Paresthesia is tingling or prickling pins and needles sensation. Usually when we're referring to this right now, we're referring to it in the hands and fingers. The hand and finger flexors, so that means like they curl, are on the palmar side of the hand, and that means the extenders are located on the dorsal side of the hand. The scientific name of the thumb is the pollex. If you remember, the hallux was the big toe, and so this is the pollex. The 8 little bones of the wrist are referred to as the carpals. The 3 bones that make up the elbow joint, that's the radius, the ulna, and the humerus. And then go ahead and delete the last question. That's a bad question about the signs of a hamate fracture and another name for it. I don't think there actually is another name. Okay, number 8, in anatomical position. So if I'm standing, my thumbs are out, then that is the radius, that is lateral. Contact when holding a sports implement, I already said that's a hamate fracture. That should say fracture, not fracture. Which 2 bones are connected by the proximal interphalangeal joint? So that's the proximal and the middle phalange. The smallest bone in the wrist is the pisiform. The most frequently injured bursa in the elbow is the olecranon or olecranon, and that's right on the tip of your elbow. 3 elbow flexors, the biceps brachii, the brachialis, and the brachioradialis. You should have had those in your chart. And then the triceps brachii is an extender. And then 1 forearm supinator is the supinator. You're welcome. Okay, we're going to talk through injuries here. Obviously, pause it if you need to. Olecranon bursitis is bursitis on that tip of the elbow. And so because it's very superficial, it makes it extremely susceptible to injury there. So usually it's a direct blow. You fall on it, you get hit there. There's going to be pain, swelling, and point tenderness. And usually it'll appear almost spontaneously, and there's not a lot of pain or heat with it. So there's a picture, and your treatment for that is just to ice it. You might want to wear like a pad over it if it continues to be a problem. They might need to aspirate it between stick and needle in there if they can't take care of it. Elbow sprains. So an elbow hyperextension or a valgus force. So you land on it and your elbow maybe goes too far. We also see this with like throwing when they come back. You can sprain the ligaments there. So pain along the medial aspect of the elbow. They won't have good grip strength. And then pain, tenderness over the medial collateral ligament. So treatment, they're probably going to fix the elbow, so in a sling or a splint at 90 degrees for at least 24 hours. And then rice it, and then gradually work your way back into things. If need be, the MCL can be reconstructed. Also, I believe the MCL and the UCL are synonymous, and that would be Tommy John's procedure. Lateral epicondylitis. So this is on the outside of your elbow where those muscles attach to the lateral epicondyle, and you get this a lot in tennis because of repeated micro trauma to the extensor muscles. So you keep like bringing your wrist back to like swing the racket. That's why it's called tennis elbow. So you'll get like an aching pain, and then eventually it'll kind of come down into your wrist and your hand. And the elbow would also have decreased range of motion. And if you tried to like resist their extension, so tell them like, don't let me push your hand down as you pull it back, then they would have pain with that one. So care is just rice and NSAIDs. You can also do some range of motion exercises, maybe some massage, and then wear a one of these, like whatever you call those things, brace or splint on it as well. So this is an image of the lateral epicondylitis. So you can see it's on the outside and the medial epicondylitis is on the inside. Medial epicondylitis, this is the opposite. So repeated forceful flexion of the wrist, and pain is produced with forceful flexion or extension. You might have some point tenderness and mild swelling. Active movement, so when you do it yourself, it's going to hurt, but usually passive movement does not. So what are they going to do for it? They're going to put you in a sling. They're going to tell you to rest. They might do some ice or some heat. And then they'll give you a little brace that you can wear to reduce some of that elbow stressing. So once again here, this is called golfer's elbow. And this is an image of where that would be. So we talked about osteochondritis dissecans in the knee, and I believe, and this is elbow osteochondritis dissecans. So when there doesn't get enough blood to this part of the elbow, then the cartilage can wear down and the bone, and so it creates these loose bodies in there. And so your symptoms would be locking, maybe sudden pain, but the range usually returns in a few days as it like maybe moves a little bit. Swelling, pain, and crepitation. Remember, that's like that creaking or crackling may also occur. Care, if repeated locking occurs, then they might need to surgically remove those things. Without removal, then it could lead to arthritis because the cartilage is not there. Okay, ulnar nerve injuries. Pay attention to this one versus carpal tunnel because they are different. An ulnar nerve dislocation can cause this. It could be a traction injury. There's a lot of things like compressing on the ligament maybe. There's a lot of causes, but the main sign of injury is that there's paresthesia, so that tingling, prickling feeling in fingers 4 and 5. So the conservative management is don't do what bothers it, and then the more aggressive one would be surgery if needed. Okay, a dislocated elbow. We already kind of looked at this. If you remember, we watched the Rondo video. There's a high incidence in sports because people fall on outstretched hands, and then the elbow just can't handle that. So signs of injury: swelling, severe pain, disability. You're not going to be able to use it. It'll be displaced. You can also have damage to nerves and vessels, so you need to be careful, as well as rupture and tear of stabilizing ligaments. And then the care: immobilize and refer to a physician. Let them handle taking care of that. So here's an image of what one would look like, and then there's an x-ray of what one looks like. Okay, fractures of the elbow. The cause of injury is usually fall on a flexed elbow or a direct blow. It can occur in any one or more of the bones, so ulna, radius, or humerus. If you fall on an outstretched hand, often fractures the humerus above the condyles or between the condyles. Signs of injury: it may or may not have a deformity, so you may or may not know that, but you'll probably have some swelling and muscle spasm and bruising. And then just ice it and sling it, and then send them off to get x-rays with the physician. All right, we're going to pause for just a second here. Whoops, let me go back. All right, now we're going to look at injuries to the forearm. So a forearm contusion is just a bruise on your forearm. It can be acute or chronic. We got to be careful of repeated blows to that area for some myositis ossificans. Pain, swelling, hematoma would be signs of it. So you're going to do some ricing and maybe some icing, just more icing, and then protect it, obviously, when you go back to play. So those are some images there of bruises, contusions. Forearm splints, we've talked about shin splints before, so the same thing can happen in your forearm. And these are repeated static contractions. You get little tears in the connective tissue. And so you might have a dull ache between your extensors, which are on the posterior side of your forearm. You might have weakness and pain, and then some point tenderness, the interosseous membrane, inter meaning between, osseous meaning bone, so the in between the radius and the ulna. Some pain there. And then just treat the symptoms. So ice that if you need to, take some NSAIDs. And then if it occurs early in your season, strengthen that forearm, really get it going. And then if it's late in the season, then you just got to ice, wrap, and heat. We see this in gymnasts a lot with the amount that they're on their wrists and forearms. So there's where the pain is. Forearm fractures. I'm sure many of you broke your arm when you were a kiddo due to falls, direct blows. Fracturing the ulna or the radius by themselves is actually more rare. So if you hear people say like, oh, they got both the radius and the ulna, that's actually more normal. Um, and signs of injury, they might have heard a pop or a crack, and then they'll have some pain, swelling, disability. It'll be edema, so it'll just look really puffy. And then an older athlete may get more extensive damage to soft tissue structures. This is a picture of like that edema and swelling that I was talking about. And so you just need to rice it, splint it, and move them on to a physician. There's another image you can see there of some fractures. Okay, a Colles fracture, I think I'm saying that right, or a Smith's fracture. These are in the lower end of the radius or ulna. And so usually it's when you fall on an extended wrist, forcing the radius into and ulna into hyperextension. So that's with a Colles fracture. With a Smith's fracture, if you fall on a flexed wrist, then it goes the other way. These are a lot less common because we just don't tend to fall that way. So a forward displacement of the radius causing a visible deformity. It'll look like a fork kind of. Sometimes they don't catch these, so they can just be a bad sprain, but there might be a lot of bleeding and swelling. And then so there might be nerve damage, tendons torn. So you just need to refer them. Complications of a Colles fracture can make it be longer than 1 to 2 months. That's more normal. 1 to 2 months is more normal. Wrist sprains. This is the most common wrist injury. Anytime you do something abnormal, forced movement, like falling on a hyperextended wrist, violent flexion or torsion, it's just going to be swollen. Remember what a sprain is. It's a tear in that ligament. So refer to physician for an x-ray if you think it's really bad, and then just rice splint. You can do some strengthening. You can tape it. Those are all things that might help. So this is a lot of times where they get the injuries. Wrist tendonitis. This is also really common. The primary cause is overuse of the wrist. So repetitive wrist accelerations, decelerations, pain on active use. So if you're like, oh, can you bend and flex and extend your wrist, then that might hurt, or passive stretching. And then there'll be tenderness and swelling over that tendon. So initially you want to really hit it heavy with ice, NSAIDs, and rest. And then you can like ease off of that, start working on some strengthening, and then you can use a splint as well. So that's De Quervain's tenosynovitis there on the left. That's what Coach Sims had, if you remember that. He had surgery for that. And then these are just some extensor tendons over here. You guys have probably heard of this. It's actually a compression of the median nerve due to inflammation and sheaths of the tunnel. So we don't probably see this a lot in athletes. We see it a lot more in like people who work at desks often. Signs of injury. So sensory and motor deficits. So there's going to be like tingling, numbness, paresthesia. So remember that like prickly feeling, and then weakness in the thumb also. So remember, an ulnar nerve injury was more the fourth and fifth fingers. Carpal tunnel is more like the thumb area. So conservative treatment is rest. You can immobilize using a brace, and try NSAIDs. And then they can also do steroid injections, or there is a surgery that can be done for carpal tunnel. So this is where the main pain with carpal tunnel is. A scaphoid fracture is caused by force on an outstretched hand that compresses the scaphoid between the radius and then the second row of the carpal bones. Okay, your anatomical snuff box is when you you spread your fingers really wide, and then down your thumb there's 2 ligaments, and in between those 2 ligaments there's like a space. That's your anatomical snuff box. And so if you suspect a fracture to that, then they would splint them, refer them for an x-ray. And then sometimes this area fails to heal because it has poor blood supply. So here's a picture of a fractured scaphoid, and then they repaired it here and put it back together. Okay, a hamate fracture. This usually results from a fall or contact while the athlete's holding the implement. We talked about that. So you'll have wrist pain and weakness, usually over by your pinky finger, because that's where it is. It's on the outside of your hand, along with point tenderness. And then the casting of the wrist and thumb to make sure that you don't move any of it is the treatment of choice. You can also put a donut pad over there if